everybody. We're going to go ahead and get started. I just want to make sure everyone has scanned in your code. You're probably used to that. This is day 2 now. So get scanned in, and then Kim here is going to present building a bridge.
Good morning, everybody. I'm going to try to use without the microphone because I guarantee you when I use the microphone, it just reverberates everywhere. So can everybody hear me okay? I have a mom's voice. I can talk loud. Jay's back there will tell me. I mean, he will give me the choice.
It's up to you, but for the recording, they have said that the microphone picks it up much better.
It's just
okay.
slow. And I can't figure out how to turn it down.
Okay.
So we're going to try this, okay? We'll wait for people to get in. As Jesse said, I'm Kim Hawekotte. I'm from Douglas County. I am the Deputy County Administrator at Douglas County over all of our juvenile justice reform efforts. So what that means in English, I wish somebody would tell me. But what I do know that I am over our detention facility, our juvenile assessment center, and then all of our various, we have probably 6 to 8 federal grants that we've been able to obtain, and then our community-based grant funds. So that's what we're doing. And what I'm going to be talking about today is building a bridge. And I think, so before I get started, tell me who's from the courts in here? All right. Who are from private agencies? Doing diversionary work or the upfront work? Who are probation officers? Who are social workers? Therapists? Who works with school systems? Oh my gosh. All right, so we're going to talk about working with schools. How's that? Because that's definitely who the audience is today. So I'm going to give a very brief background on how this concept came about and why we're talking about it and what we're going to talk about today. And we started this project about 2 years ago. And all of us know, what were we in 2 years ago? COVID, right? And we became very concerned as a community how COVID was impacting our youth, their attendance at school, and what was going to happen once COVID ended. At that time, we were hoping it would end, and what we were going to be doing about that, because we had real concern about our attendance at schools. And as you know, Douglas County has many different school districts with a variety of things. So what we're going to talk about today are really what is a family resource center, what are the needs and what we found the needs were in Douglas County and how we went about figuring out those needs. What is the bridge, Family Resource Connector Network that we have set up in Douglas County? And then how can you create one in your area? Because I know most of you are not from Douglas County, so you're wondering how do we do it in other parts and other areas, okay? So, how we came about. We had high rates of juvenile justice and child welfare system involvement, and we have, in our system, we felt a lack of that prevention, early intervention services for our youth and families, especially within our status offense youth. And when I say status offense, I'm talking those kids with mental health or excessive absences, correct? Because most of us, all of you included, most of our counties have very strong diversionary systems for youth that have law enforcement contact. How do we keep them out of the system? How do we meet their needs? How do we provide programming so they don't have to get into the juvenile justice system? And what we found in Douglas County is we don't have that strong a system for our status offenders. And that we were seeing youth being filed on in court because they had severe mental behavioral health issues. And that was the only way to get them the treatment they needed. Or we were waiting until kids were missing 30, 40, 50 days of school, and they are so academically behind and disengaged. How can we get to them when they are missing 10 or 15 days instead of waiting so long? So our goal really was, when we started this project 2 years ago, to build a system throughout Omaha that supports, inspires, guides, empowers strong, stable families. We knew, based upon our data, that we have some target zip codes. There's about 5 zip codes that when you look at our data, the majority of our youth are coming from. And I don't think it surprises anybody in this room that the majority of those zip codes are brown and black kids. So how do we really target those communities to ensure that we have providers and the ability in those communities? So that's really what our goal was, our system focus when we started. So we developed some long-term outcomes, and you can read them there. In Douglas County, and I think it's true in a lot of counties, we have many, many great providers. We have great providers. But let's just face it, it's not a very coordinated system for families to access those great providers. Or they call one number and they're like, well, we can't help you, but here's 2 or 3 other agencies that can help you. Now, you go call them. And let's face it, if I'm a family in crisis, I'm not sure I have that energy to do it. Because I need help now, not 5 phone calls later when maybe I find. I mean, how many of you, this is the example I always give, when you go on Google, if it takes you more than 3 to 5 seconds for something to pop up, don't you give up and go on to something else? I mean, we need things now. We're just used to it, and that's how we go. So that was one of our long-term outcomes. We also really wanted to have improved efficiency in our resource allocation. In other words, how do we know, or from a county perspective, how do we know we're funding the right programs? How do we know this is really what the needs of the family and the youth are? Or is it the needs that we, the system, are saying, this is what you need, family? I mean, how do we include that family involvement because they know what they need better than any of us? But all of us create programs and services going, I think this family needs X, and this is what we've created. Now take this. So we wanted to really switch the paradigm on how you think about it. We wanted a reduction in cross-system disparities and increased equity. I mean, all of us know the data out there that our status offenders have a high probability at some time of entering the juvenile justice system. Some states show as high as 85%. Majority of states are at 60 to 65%. Why are we having a system that forces those kids to enter the juvenile justice system when they are 14 and 15? What can we do earlier? We talked a lot about, and I'll say this a lot, those pink flags. For those of you that work with families, can't you go, gosh, there's like 3 or 4 pink flags here. They're not red flags, but there are some pink flags here that if we could address those pink flags, they might never become red flags. But as a system, because of the way a lot of things are set up, we wait till it becomes a red flag, then we deal with it, then we get the provider. So how can we get at the pink flags? And then for us was really to establish a county-wide network and access to all of our programs and services. Not to create new programs and services, but to create an apparatus that we can get it pushed out to our great community providers. So this one is just, it looks very much the same, but this was our family focus, because one of the things we really talked about too is if you are doing a prevention early intervention system, it cannot be system operated. It needs to be driven by the needs of the families. The families have to be able to direct what they need. That family voice and choice is center to everything in a family resource center. And that's hard. For those of us that have worked in the system, for me, I hate to say I'll just mumble that. It's difficult because it's like, well, we're used to the family, you're ordered to do this, you're gonna do this is how you're gonna do it, this is when you're gonna do it, right? Do we really always listen to the family? Not really. So some of the long-term goals from a family focus, of course, is reducing the number of kids in our system. I mean, I'm an attorney by trade, for those of you that know me. I've worked in the justice system for over years. The wheels of justice do not move fast, do they? They move slow. And when they move that slow, are we really helping families because it's moving so slow? So how do we really reduce the involvement in that system to get those services in there earlier? That was one of our goals. How do we empower youth and families to drive their own? I'm sure you heard some presentations yesterday How do you really bring in that positive youth development? How do you deal with the strengths that the families and the youth have in this early intervention area, not just that accountability piece? And last, ensuring equitable access for all families. Because let's face it, for some of us in this room, if we needed help, I could call up my friend and go, my kid's doing ABC, who do I go to and where do I go to? They tell you and you do it. But for the majority of the families we work with, they don't have that kind of network. So how do we as a system create that kind of network for them to be able to do? Make sense? So now let's talk a little bit about what is a Family Resource Center. When we started on this project, I had never heard of Family Resource Centers, I'll be honest. And all of a sudden I'm finding out there's over 2,000 across the country. This is not a new concept. There's a National Family Resource Center network that deals with states. They're out there. But there's some core parts of a Family Resource Center based upon the National Center that they say you need to have. It has to be shaped by families in the community. They have to be part of the integration from day one. They help determine what the needs are in their community, in their area, so they can be met. It has to be multi-generational. How many of you deal with families today where the grandparents are raising the kids? Or an aunt is, or a friend is. It has to be multi-generational. So what that means is Family Resource Centers have to provide services from 0 to 85 years of age. You just do, because there's a multi-need. If grandma is taking care of the kids and she's 75 and she has health issues, that's going to impact the family, right? So if we don't help grandma's health issues, how can we also help the kids? So it's really thinking about that wraparound inclusive approach. It's designed for all families. Too many, and you know, like I said, in Douglas County we have a lot of federal grants. And when you have federal grants, it is targeted towards one thing, right? We're going to work on missing runaway youth that are being sex trafficked. That excludes 99% of the other kids, right? So we were bound to determine that this has to be designed for all families. Low or no cost. You can't charge. You can't charge a family $100, come and talk to us, and then we'll tell you we can't do anything. No. It has to be low or no cost, right? And you have to support families to build those promotive and or protective factors. I'm assuming all of you know about protective factors here, but isn't that what we're trying to do? We're trying to do the proverbial teach them to fish and not just give them a fish. How do we help sustain them in the long run? That they become self-sufficient. So when it comes to Family Resource Center services and supports, it really is a hub. It's a one-stop shop, for a better way to say it, to provide the access to the service. Most Family Resource Centers work a lot like, in my mind, because I helped create the Juvenile Assessment Center 20 years ago for diversionary youth with law enforcement. That entity, or the entity here with the Family Resource Center, that does that assessment, it does the navigation, then it pushes it out to all of our community providers. It doesn't provide those direct services, it pushes it out to the one that fits the needs of the families. Which might mean, which is unusual many times in our system, that means 4 or 5 different providers. How many times don't we work with the family and say, well, we're going to refer you here to Happy Family, and they're going to meet all your needs, and you and I know you can't meet all the needs by one provider for one family. Okay? Working with families over time. I don't know about you guys, I don't change easy. I can't imagine families change easy. My kids don't change easy. You have to take some time. And we have to acknowledge for many of this, prevention, early intervention work, those families might come back and come back and come back. And that's okay. Because they're learning something every time. So how do we do that? And then co-location of resources. I think whether you're in the rural areas or you're in Douglas County, if I told a family in North Omaha that they had to go to a service provider that was on 180th and Dodge, they couldn't get there, nor should we expect it. And to me, in the rural areas, it's no different. You have to have some of that co-location of services. You have to have those services easily accessible to those families so that they can access them. You can see this slide. There's 10 core characteristics of family resource centers that they always talk about from the national. I think all of them make very much sense. You have to set standards. You have to have a welcoming space. Would you go to something that isn't welcoming? I mean, your people have to be welcoming. You have to be willing to work with them. You have to partner with families in the community, strengths-based, culturally responsive. I firmly believe that with these folks in the community working with families, and the people at that resource center have to look like those people that they're working with in the community. They just need to. We have to become more culturally responsive. You have to have well-trained staff, parent and community leadership, prevention focus, integration, all that good stuff. So, when you talk about a family resource center network, because that's what we ended up on, how many of you live in a community that has community response? All right. To me, this concept is taking community response and putting it on steroids. Don't know how else to say it. It's really taking those core things that community response does well in many areas of our community and figuring out how do we expand it to cover more people and how do we provide easier access. So when you look at the Family Resource Center network, in the middle there you have the backbone support organization, because let's face it, anytime you have an organization, somebody has to step up and say, we will pay the bills. We will make sure that staff are trained. We will do all those type of things, correct? Because if you don't have that, then it's very different. So you have to have that backbone support agency organization. And then you have to ensure that all of those people working in the community are those spokes, that you have a common agenda, that you have continuous communication, you have reinforcing activities, and you have a measurement system. And to me, because I have a wonderful data person over here, that measurement system is imperative, because how do we know that we're really meeting the needs of the family if we don't hear from the families and collect that data to then develop and help our community providers to say, you know what, 90% of the families we're seeing need this type of service. Who can create it for us? What does it need to look like? How do we change it? So that's what really a network is. I put this slide in because as we were working on it, we really were very blessed with a private funder to be able to work with a national organization out of Colorado. And I'm going to talk about their report in a little bit. And the reason we went to Colorado is Colorado has had, by state statute, since 2007, 2008, that every judicial district in their state has to have a family resource center. Okay? They did it by statute. The other nice thing we know about Colorado, I'll be very honest, is they have a lot of money because of legalized marijuana. And a lot of that legalized marijuana money goes to help pay for their family resource centers. I'm not advocating any of that, so please don't say Kim's advocating. I'm not. I just say we have to face some realities that as a state, we don't have that kind of extra income that can go to nonprofits. But that's how Colorado has done it. So we worked with a national organization called Omni out of Colorado, and they helped us come up with, there's kind of 5 different types of family resource center models that we looked at. And I think any community can select any one of these models depending upon what works the best in your community. Because they all are effective. And as a group, we looked at all these different types. It was COVID, so a lot of it was by Zoom. We also went to Colorado, looked at 2 or 3 of them. I mean, there's all these models. Some are set up where it's embedded within a community organization. So Happy Family is the family resource center and it's done. Some of it is embedded with a government department. You know, that it's the state, it's the county, it's the city. It was actually within a governmental department. Some are school-based. When you go to Kentucky, Kentucky by statute says every school building has to have a family resource center, period. And you're going to have a social worker in that school and they're going to be doing this. We again don't have that kind of statute. So some are school-based. Some are operating their neighborhood ones under a lead organization, and then the last one is a freestanding Family Resource Center 501c3. Now what we decided to do in Douglas County, and I'll talk a little bit more detail about this later, but we decided to do the last one. As a community, we came together with all of our key stakeholders, from schools to our, we call them FRQCs, your federally, health centers. We went with the city, we went with the county, we're a learning community under statute with our learning community, school districts, private funders. We went to all of them as stakeholders and said we need to create a 501c3. And the reason we did, because there has been some questions about that, why did you do it? Why isn't government run? Why isn't it government operated? Why the county aren't you operating it? We did a survey of families in Douglas County, and there were some things that I'm going to talk about in a minute that were very clear, but there were two things these families were clear on. We will not go to a government agency because government takes my kids away, they put them in detention, they do something, you're going to report me, I'm going to be in trouble. You're going to deport me, you're going to do something. I will not go to a government agency. And in our area, they said we will not go to our schools. But I think in a lot of areas, they would go to schools. I'm just saying what we heard in ours. So that's why the survey we did of families, we felt was so important, because we wanted to hear from them directly where they would go. And if anybody wants a copy of that survey, just reach out to me. We'll share the survey. We have it in 5 or 6 different languages. We have the survey that was set out. So what did we find in Douglas County? Our goal, so let me back up. I'm going to do a very short time history. So about 2 years ago, we started meeting internally within Douglas County to say, what are we going to do with these kids? We looked at our data with regards to truancy absenteeism in our community. We found over 12,000 kids that year were absent or truant. How do we ever set up a system for 12,000 kids? Our juvenile assessment, I don't know about you guys' diversion programs, you're not set up for 12,000 kids. It's like, whoa, we got to do something. So we started looking at the data. And we talked to 3 or 4 different family resource centers across the country, from Las Vegas to Missouri to the East Coast, and said, how are you guys doing it? And learned from there. Once we did that, it's like, oh, we need to do, as it talks there, an environmental scan. So we were very lucky and got some private money to have Omni come in and do an environmental scan of our community. And I think what they found is relevant throughout the state. So youth and family needs. When they did their environmental scan, these are the 5 areas that they found that our families said they need in their environmental scan. They had basic needs. I need food. I need concrete supports. I need a place to live. They needed mental health. Mental health was one of our top ones, probably 60%. Family relations. We all know that's an issue, correct? Chronic absence and truancy, and then a continuum of services and the navigation. That's what the family said in our environmental scan. So when it came to youth and families' basic needs, this is in the slide deck too. We all know at the bottom that the good old pyramid that all of us love to see. You know, you have the basic needs at the bottom. If you're not going to meet the basic needs, you can't meet the basic needs, you can't get to the other things, correct? So you have basic needs, the psychological needs, and then the self-fulfillment needs. What we found in our environmental scan is that 12% of the residents in Douglas County live below the poverty line. We also know that 14% of our families experience food insecurity. Now, I know that sounds like a low number, but when you take that you're in a community of 800,000 and 10%, that's a lot of families that are in some type of crisis. We also know when it comes to our basic needs that we have limited access to basic support services and the lack of knowledge about what's available in the system. So when it came to the mental behavioral health, I don't think you guys are surprised about this one either. 50% of the parents report their child needs behavioral health. Not surprising, is it? So what we did is, as we all know, here in Nebraska, the Nebraska Helpline covers all of Nebraska, correct? So we looked at some data from the Nebraska Helpline, because we're like, those are families that are calling that to see what they need. 40% of the families calling the Nebraska Helpline requested behavioral support. 40%. Out of the thousands and thousands of calls they get, that's what the data showed. So we found some service gaps in our community on trauma-informed providers, family choice, and culturally responsive services. We found that. So this goes into just a little bit more. When we looked at the data, it was 2022. There were over 10,000 calls to the Nebraska helpline, sorry, not hotline, helpline. And a lot of the areas of concern that were raised, as you can see there, system fatigue. They're just tired. They're tired of calling everybody, trying to get help, not getting it solved, not even knowing what they need to do to solve. They have system fatigue. I practiced in juvenile court for many, many years, and I would see that on the families' faces. By the time you're a year and a half into any child and abuse neglect case, you could see it on the parent's face. And you guys probably can too. They're exhausted. I'm tired. I have tried to be nice to you, and you, and you, and you, and I've tried to do what you tell me to do, and I'm still not doing it, and I'm just tired. So I think that happens also in our early intervention system. Also notice there, 50% of the parents were referred from the helpline for parent education and support. One of the things we have had serious discussions in our community about is what does parent education look like? Because as a system, what we've really developed through the years is that parent, you're court ordered to go to parent education, you go there, you sit there for 7 weeks, you completed the course, check, you completed it, now I can parent. Do you, and what we heard from parents was, we need more mentoring. We need somebody to walk with us. We need somebody that will say, this is a good way you should be doing it. Now let's model how you're gonna do it. Let's talk about it. Let's work on it. Does that make sense? And then somebody that I can call at 9 o'clock at night and going, you know what, Johnny just used that nasty word at me again, tried to hit me. What the heck am I gonna do? Because I wanna hit him back. Help me work through it. That's what we heard from parents. Service gaps, I don't think that is any surprising either. Absenteeism and truancy. As I said, this is what our original discussion was, and then it became much broader. When we looked at our data from Douglas County, 25% of the students are in special education, 25%. That means IEPs, that means are they being met? Are they even doing the behavioral supports that are supposed to be happening? You and I know that isn't happening right now. 21% of students experience chronic absenteeism. We used 2018 and 19, I'm going to tell you, because the COVID years, the data is garbage. So we used 18, 19, because that was the last year the kids were actually physically the proverbial butt in the chair, okay? 21% of our students experience chronic absenteeism. That's 20 more days. That's 21%. That's why I said you're dealing in the 12 to 14,000 of kids for us. And that's how many truancy filings were in 2018 in Douglas County. Okay? When you look at the bar graphs, we broke out the chronic absenteeism by grade. And I don't think any of you are surprised that as a kid goes 10th, 11th, 12th, it goes up. But look at that 12th grade. 41% of 12th graders miss in Douglas County 20 or more days of school. 41% is a lot, right? That's almost 50%. Now some are fine, some are not. Also, when you break down that data and you start looking at race, look at how it changes. When you look at race, American Indian, Alaskan Native, 44% of the kids registered for school missed 20 or more days. When you look at Black or African American, it was 37%. Native Hawaiian Pacific Islander was 31%. 2 or more races was 25%. So we know race plays into it. We also know poverty plays into it, correct? We know there's inconsistent coordination and cooperation between school districts and providers. And there's a lack of family engagement. When we really started looking at some of this data in preparation for the bridge, one of the things we found as a community, we have a lot of early childhood work from birth to first grade. We have a ton of great programs and they're awesome. And then our juvenile justice system starts about 13. We have some great, what are we doing for 8-year-olds, 7-year-olds, and 13-year-olds? What are you guys doing in your community? Isn't that where you start seeing those pink flags? Where you start going, oh, I think this family is struggling. We need to do something. And so as a system, what do we do for that age group or those families? We found nothing, we really do. Other than individual providers are doing some great work, so I'm never going to say that. But for a family, that's luck of the draw if you end up with happy family. That's going to help you. So we really started looking at targeting that 7 to 13-year-old, knowing that there was a huge gap in our system with that.
I wanted to comment real quick on your data on that last one, because being a twin stop for 14 years, you know, state statute has changed 3 times.
Right.
And it's really been tough for families in the Nebraska Family Coalition. You know how they uproared because every time you got sick, you need to bring a doctor's note. And some families rebelled over that because they're making their expenses higher. So then they finally got back to the legislators, and then they changed it again to say now the principals have to do an investigation before anything is filed.
Right.
And those are really what throws data off again.
It does.
And it's really tough when and it's almost back to where it started 14 years ago, like a call, hey, my kid's sick, but it's still kind of unexcused, and it does add up. And for the Native American side, probably I can speak of, because when we have funerals, when our people pass away, there's a certain ceremonies that go on, and that's taught from generation to generation. It is literally, we take 4 days to put somebody in the ground, and our families are there all night. Children are helping cleaning, helping serve, and so that really contributes to those absenteeisms.
It does. And that's why we firmly believe, and thank you so much for that, you have to look at more than just the data. The data will tell you, oh, there might be an issue here, but then you have to look behind the data and see what is really going on and is there something to do. We hear from some of our Hispanic Latino families that when they go back to Mexico, you don't go back to Mexico for a visit for just 2 days. You're there for a couple of weeks. Well, then you're missing a couple of weeks from school. And then all of a sudden, they're considered truant. So you really have to look a little bit further than that.
Are there any, is there any data available that compares districts? Because Omaha is one of the most segregated cities in America, so if we're having the segregation and we can say OPS has this issue, Millard has this issue, Bennington has this issue, do we have data that we can see that shows that?
Yes.
Because I feel like that paints a different picture.
It paints a very different picture, and I didn't want to get into all of our various school districts. But if you want that data, just contact Abby or I, and we will make sure, because we do have it broken down by school district, by school building. Now, the one data I do not have, and I want really, really bad, is suspension expulsion rates.
Yes.
Yes. Okay? And I am not getting it. The data I do have is a couple of years old, because I keep hearing rumors that suspension expulsion rate, especially for my 8 to 10-year-olds, is skyrocketing. Need to figure that out as a system here, guys. So I think the legislature has to work with that. So when you talk about, I have about 5-10 more minutes, youth and families continuum of service and navigation. The whole concept of the bridge, oh, that's Rachel, and I think disparities too. The whole concept of the bridge is a hub and spoke model, where you would have a hub that will do that operational, that background stuff, and it's its own 501c3. But the actual work with families is done in the communities by spokes in the community. And those navigators that will be working and assisting families will be at those spokes. Now, have we determined in Douglas County where those spokes will be? No. That is something the executive director, Marion Fay, is over here for the bridge. She'll gladly talk to you. That's what we're trying to determine, because I think in some areas of our city, it might be in a church. It might be in a school if that's where they want it. It might be with a nonprofit. It has to be where families feel welcome to come. The also key that we stress with each one of these spokes out there is they have to have their own advisory council from the community. That advisory council will help determine what services are going to be offered there and what it is their needs. Not the hub, those spokes out there have to be listening to them. All right, does that make sense? Because it's going to be different. I can give different areas. I get a little bit frustrated when people say, well, it's North Omaha. Assuming that the people in North Omaha have all the same needs. And what we found when we looked is, people at 24th and Lake might have a very different need than the ones at 60th and Hamilton, than the ones at 9th and somewhere else. So it has to be based on those individual communities, is what we really felt. Race, it's in your slide deck, because I know I'm starting to run out of time. You want absentee data broken down more by race, on 15 or more. Also, we also know one of the data we really looked at too, just because we operate the detention facility, 43% of youth arrested were black or Hispanic, brown or black kids in our community. 43%. You and I know that isn't what the percent is in Douglas County. I can also tell you as of today in our detention facility, I think we're at between 92 and 95% youth of color in detention. Okay? Consistently. All right? And that's not a statistic, Mark works at the detention facility, that I like to give, but I think if we don't shed light on it, we as a system are not going to solve it, because it is not something a government entity can solve. It is a community issue. Okay? Community assets, the ways that you can go about looking at it. This is what the bridge stands for, so that you can see. It's building relationships that inspire one another, develop mutual trust, guided by family, voice, and choice, and establish equitable partnerships. Everything that we've already talked about, right? So when you think about the bridge, and I already talked about this, it's that hub and spoke model, that the bridge would be the backbone support organization, and then you would have different family resource centers throughout our community. Main function is really that central navigation. It's having a process by which to help families assess what their needs are, and then having that person be that navigator. And not, I hate the word, not a warm handoff, because let's face it, there really isn't much of a warm handoff. Here, go contact this. But walking with the family, getting those appointments, setting up, going with them if needed the first time so that they feel comfortable. It's those next steps to ensure you have that family engagement. This is a responsibility, like I said, your slide deck is there as to what the backbones, which I think all makes sense, right? Administrative, you pay the bills, you do the marketing, you do the advocacy, you do all that stuff. And then the local spokes, the local family resource center, this is what they do. Community outreach, community engagement, family-friendly services, and programs and accessibility. Make sense? I got 5 minutes here, guys. How can you create one in your area? I think for many of you, especially if you have community response, you're doing it. But how can you do it more coordinated? How can you make it easier and more accessible for families? Do you need brick and mortar, or do you not need brick and mortar? Do families know where to go in your community? And if they do, what would that need to look like? I know for those of you that have community response, the foundation, Children and Family Foundation, has worked very hard through the years to help build up the community response. They're also part of working with each of you to help develop family resource centers within the communities for those that are ready to go for it. Because it has been a huge success in many areas. And I have that on a slide deck too, so if you need to know if you're in one or not, it's there. From the collaborative. I'm just going to open it up for questions because we just have a couple of minutes. Questions?
One question. For the mental health, have you heard anything with regard to the crisis response teams? Have they taken any traction as far as getting in front of some of the charges with the mental health?
Can I mention that?
Yeah.
I am community response for family and youth. Are you referring to Centerpoint?
Well, actually,
He's in Douglas County, but we have the same thing that you guys are trying to do.
You know what? We've been getting a lot of calls from Omaha. That's why I was kind of wondering, and I don't have access to give them who they need.
well, there's a crisis response team that have been working in Sarpy for a number of years, and through Lutheran Family Services, they were doing some. But I believe that Omaha Police Department has added crisis response to some of their law enforcement. But my question is, are those crisis response folks getting to the families at the point when the law enforcement is coming?
They are.
They should
They are.
be.
Yeah.
They are. It's, again, to me, it's how do families access it? I mean, that's an area, I think, at least in Douglas County, Mark, we've been working on is, we have a great crisis response teams, but how do families access it? Do they have to call 911? Because right now, some of it is set up, they have to call 911, 911 then refers them to the Nebraska Helpline, the Nebraska Helpline then screens them, and then if the Nebraska Helpline says they need it, then I contact Lutheran. If you're a family in crisis, that's a long way to go.
If you
So
call
we're really
988
working on
or
that process.
LPD, they activate us. And
Right.
Yeah, some parents have said they've been a little hesitant. They weren't quite sure if it would bring more issues or not. So I think if there's any way where that information can be accessed or shared with families so they realize it's a resource that can happen. You know, some families are hesitant to call law enforcement, but if they knew they were getting some mental health support at that time, I think it would change the trajectory for a lot of families.
there are times we can go out without, if we feel comfortable without LPD.
Okay,
Because I know me and my team, we will go out without LPD since, I mean, obviously it's a big stigma. You don't want to get arrested, you don't want to get locked up. We understand that, that's what we're trying to avoid actually. And especially for youth, once the parents feel like your kids are going to be gone. I mean, so I don't know if they will. You can probably talk to them and they probably will because we do go out to people without LPD.
That's a process we're working on. How's
It's,
that?
yeah.
There's political issues involved, like many things in all of our lives. There are political issues involved. I guess we have a couple of extra minutes because we started late, so we have a couple extra more. So I can take a couple more questions.
I just wondered, have you actually implemented any of the like actual physical locations in Douglas County? Do you have any statistics in that?
Okay, so I will get you up to speed on that. So after all this happened, so last fall then, and I really didn't talk about the survey, but if you want the results of our survey, if you want to see the survey that we did of families, you're more than welcome to. And the survey was very clear. The families really need navigation and mental behavioral health services. I mean, that's what they kept saying. I can't control my kids. I need some help. I need parenting help. We also did some focus groups in North Omaha about a year ago. We had a lot of juveniles that decided to shoot and kill each other. And so we contracted with a private entity who did focus groups, first of all the parents the kids were victims, and all the parents whose kids did the shootings. And we learned a lot from those two groups of people, those parents. And I admire them immensely because they were very transparent and said, I have lost control, I needed this and this, I didn't know where to go to. And so we relied heavily on those type of focus groups because again, it was the families that were in those crises that had to live it. I never have, thank God, and I don't ever want to, but they did. But no, so starting last fall, we did set up a 501c3 that's called The Bridge. As you can imagine, the government and the nonprofit status and getting it through those little hoops. There is a board of directors. The board of directors is a public-private partnership. So there are school superintendents from 2 school districts. There are our health centers, our 2 main health centers, Charles Drew and One World. There is a private funder. There is the city, there's the county, there's the learning community. We have 2 people from our community, Douglas County Community Response, that sit on the board. We also have 2 positions for families with lived experience, because I think they have to be on the board, able to make those decisions. So we got that all selected. In January, Marion Fay was hired as the executive director, so she's been there like 3 to 5 months. Philip Burrell is doing a lot of the community program on it. They are working right now, because there were 3 school districts in our area, Westside, Millard, and Ralston, that saw a need in their community, and they put some funding in because they want a family resource center kind of centrally located for those 3 school districts. That one I think hopes to be sometime this fall.
It's a pop-up, but.
You're right. Right, that they will be, and then they're currently working in North and South Omaha to help. You gotta meet with the providers, you gotta meet with the families and determine where those locations would be. So that will probably be 6 months to a year after that.
If the buy-in from the districts who need it most, because they have the students that live in poverty and they have the students of color, if the district doesn't buy into it, what is the backup plan? Because the families need it, even if the district won't agree with the bridge. So what is the backup plan to still get help if bridge can't work for the families because that district won't work with you?
I think so far the school districts have been. I'm saying the one I know you're probably thinking about has been a little bit bigger of a struggle. But what I will say, as we know within that school district, a lot of those schools have their own social workers. We are going to that level, and we met with them before to say, guys, you're the social worker. You see these families every day. You're trying to meet the needs. This is something that can help you to make a referral to. So we're kind of, while Marion works with the administration, we have some groups that are really working at that social works counselor level, because at that school building is really where I think they can make the difference. And you and I know, and you and I probably agree, I can tell you what schools we're targeting and talking to, okay? I know you can. But I'm just saying, we know what they are, so let's target them and let's start there. So, other questions? Well, then.
So, actually, one thing that I've been working on, because I'm from Los Angeles and I was in the hospital. And so, with our situation, I can relate to all of this, considering that I grew up in a decent area of Los Angeles, but when I moved here, I noticed that all the resources are hidden. So what are we doing to educate parents to get those resources? Most of the education that I've seen and suits better are from the schools. The reason being is that the school is a government entity, but it's a government entity for the students. And that's how they've been getting resources. So when you said that parents didn't want to get help from the schools, I was really good at seeing how we can start incorporating the schools to get more.
I think the schools definitely, if you're thinking about doing this, the schools are imperative. If you think of a stool, they are one of the 3 legs you've got to have are the schools. Now how it looks could be very different. But I think also because, very different than maybe some of your rural areas, Douglas County has so many people and it's so large that I think you just have to look at it a little differently. So can we use the spokes, the local family resource centers for the schools that have direct access back and forth so that they're referring and using those spokes at the schools to help those families. So really the family is going to one place and they go there and then they'll get out to the community providers. Whether it's a food bank, whether it's I need a wash machine, I need tires, or my kid's out of control and I don't know what to do, or I need a job. I think workforce development, I'm going to say, we haven't done it as much as we need to. I think workforce development is key to some of this too, for the parents, also for the teenage kids, but for the parents. A lot of these parents need some workforce development assistance.
And not only that, I know the difference between South and North is that South people is more Hispanic kids. They're more afraid of getting deported.
Yep.
That is their main concern when they start asking for help, but they need to understand that's where the key component of education comes for the parents, that they need to understand they will not get deported if they ask for resources. That is not the case, and many people are afraid of that.
Right. And he was just talking about a lot of, we have in Douglas County a really larger immigrant refugee population, especially from all over. And we're trying to work with some of the different agencies in Douglas County and that immigrant refugee. That's the population we heard very clearly. It cannot be government because we will not go there. You're going to do something else. You're going to call the cops. You're going to do something. It's got to be someplace that I feel safe, that I know what I tell you is not going to be turned over to somebody else. We need that type of confidentiality. Last thing I want to say, Senator McKinney from Omaha, this last legislative session, did submit a bill to have state-run family resource centers. It didn't go anywhere. We have talked to him. I think he's got some great concepts and ideas, and I think he wants to do some further research into it. So if at the state level we can get some funding for some of these things, I think that would be awesome for all of us, so that you have consistent funding and you're not always having to go to private providers and other places to do it. So keep your eye out for next legislative session if he continues to push this forward, you know, how we can all work together as communities to say this is what our community needs. Okay?
How has law enforcement been part of these conversations?
Peripherally. Because you know, in Douglas County, I have some very vocal law enforcement. We have met with all the police unions. We have met with the sheriff union. We meet monthly with the chief of police. We meet monthly with the sheriff. We have those discussions. And what law enforcement is telling us in our community is they're excited for this because they will get called out to a family. They really don't want to ticket that family, but they see the family needing help. They would love to be able to refer to the bridge to say, here, contact here, it's 2 blocks away, and they can help you. So far, law enforcement has not been an impediment. They have been at the table willing to work. So we'll see. Anything else? But law enforcement needs to be at the table. Okay. So. We haven't filled those seats yet. Marion, maybe you want to say how we're going to fill them?
Yeah.
You have to talk pretty loud.
Okay. We're working with community organizations that have good relationships with parents who might be a good fit, and then we'll just sit down and having conversations to see what their interest is, if they are, have the interest, the time, what barriers are in their way to serving on the board, so that we can work with those. So we're just right now having a lot of conversations. I have a meeting coming up with one. We've traveled down and had some of those preliminary meetings, and I think she's excited about serving. So what I really wanted to do was create an environment that made it successful for everybody, and not just have token representation.
I also think it's important, and the board has to have the discussions with lived experience people. You can't expect them to do it for free. I mean, I'm sorry, they have to pay babysitters, they have to do something. So how do we as a community step up to say, we will help, not pay you for your time, but help at least cover your expenses so that we have your ability to be there. Because that's what I've seen on too many things where we have the community involved but we don't pay them, we don't help them, we don't give them food, we don't take care of their kids, and we need to do a better job of that. So it's a great question. It's something we have to do. I mean, the hub portion of it is.
The infants, yeah. So I was hired in January, and we've spent the last 5 months just setting up that infrastructure piece, making sure we can have a payroll and provide benefits, and all of those things like providing the internet. And you have a retirement plan, so it's taken this time to get that going.
Right.
Where are you physically located?
Yeah, in my house. So you're welcome to come over and sit at my kitchen table.
You have tea?
Absolutely.
Excellent.
Yeah.
We see.
Yeah, so right now we don't have a physical location, but, yeah. So,
Getting there.
yeah. Well, the whole idea is, and that administrative hub for me, having a physical location for the administration portion is less of a priority than finding those trusted places that our advisory groups tell us they want the family resource centers to be. So I'm completely kids. We've met with them too. So I've been putting more of a priority on creating, on figuring out what that looks like. We're at a point right now where we're working with stakeholders, meaning families, community partners, schools. We are talking to OPS, had really good conversations with them about assembling those advisory groups so that they can tell us where we need to be.
One thing we were bound to determine when this whole concept came about is that it's not brick and mortar. You need a building, but you don't need to build a $30 million building, okay? Not when I can take that $30 million and put it to its families. So we're really heavily reliant on other providers within our community, sharing space, working together for the betterment of families, which I think makes more sense.
In Douglas County, I agree.
Right.
It might not make sense in a
Right, in other places it might be different. But for us, I don't need a building with somebody's name on it.
I'd rather be in places where families already have those trusted relationships, where they're already going, and we can just provide resources and links and that navigation to the services that aren't being handled at that location.
I know that you talked about not being connected, government connected, or a lot of people say we don't want any association with the department, which I get it. But is there consideration for funding from like FFPSA or that central
There
navigation?
better be. But no, I forgot. HHS is on the board of directors also.
Okay.
Because to me, this early intervention system is community response,
Yes.
is Family First Prevention Act.
Well, and that central navigation funding is coming down the
Yep.
pipe.
Yep, it's
This-
coming down the pipe.
it
So
absolutely is.
that's why HHS is at the table and has been from day one.
Yeah.
Because that isn't important. Because when you're dealing with 7 to 13-year-olds, it's not juvenile justice, it's child welfare that's going to be stepping in with those families. So let's get them at the table and talk about it. Okay? So yes, HHS is. That's my bad, I forgot. All right. Thank you all very much.
And then real quick, everything this morning is going to be pushed 15 minutes. The app will be updated, so your paper copies will not be. Okay.